and then you studied under the famous trauma surgeon, Dr. Red Duke,
Absolutely.
who I want to hear more about him. And he also performed the wedding ceremony for you and your wife.
Married us in our backyard along with his dog.
That's pretty awesome.
Yeah, it was actually really cool because we had a swimming pool in our backyard,
Okay.
and Red comes. You know, the guy was larger than life, right?
Yeah.
But in person, he was every bit as genuine as you would expect him to be. You know, long-term Texan, and he came, brought his dog with him. And while he's doing the ceremony, you know, dearly beloved, he's reading out of his really old book. His dog goes off and starts swimming in the swimming pool. And so, right about the time we're holding hands and exchanging vows, his dog comes up in between us and shakes himself off.
No.
And so, we have this wonderful photo of myself, my wife Michelle, Red Duke, and then Jake, and this giant shower of water from the dog showering everybody. So anyway, that's my Red Duke gave us both a marriage and a bath at the same time.
And he was like the pioneer, one of the pioneers in trauma surgery, ER, life flight. I mean, the whole thing, right?
Yeah, so a very well-respected trauma surgeon. Life Flight was really his big thing.
Yeah.
There were two programs that started up right about the same time. I think one up in maybe Pittsburgh started just a little bit before the one in Houston, but this is now the flagship Life Flight medical evacuation program in the country.
The Houston one is.
Yeah, the Houston Life Flight Memorial Hermann. They run 3 different bases. They don't. So most life flight programs are based at the hospital where they land.
Okay.
Houston is so big, and the program is so big that there are external bases where the helicopters stay in order to shorten the flight
got it.
time. Yeah, out to wherever the.
So if they get a call in
patient-
Katy, there's something out that way and that sort of thing.
Correct, north, south, and west. I
Nice.
think it's now 8 or 9 helicopters.
Wow.
And they're just about to start expanding it again. So
I did the helicopter tour at the Med Center at Herman, and I invited some buddies, and they rolled out the red carpet for us. So we went up there, and I was thinking like, oh, this is gonna be cool. We're gonna check, and it was. But while we're up there, I mean, they were bringing people down, and it went from being like this fun thing to, oh my gosh, there's a real live person with real live problems coming off this helicopter, and I mean, it was intense.
it's fun to visit, but you know, you don't want to be on that helicopter as a patient. But if you have to be, I think you're really, really happy that we have this super highly functioning program with, almost all the pilots are ex-military.
Yeah.
That have an enormous level of experience in the flight medical groups. They see a lot of difficult stuff, and they do a fantastic job. You know, one of the other interesting things about Life Flight, we push our research that we do at the medical school on traumatic injury resuscitation. We push that all out to the helicopters, and they start that treatment in flight. So things that have come up, like using different blood products for resuscitation, they have all those things on the helicopter. They do ultrasound for diagnosis. These are things in most places don't happen until you're in the emergency room, in the trauma bay, where you have physicians running it. We have that stuff being done on the helicopters by the flight medics.
And minutes really count in those type of scenarios, right?
We say every second counts,
second
right? I
counts,
mean,
yeah.
it used to be the golden hour. They said that's kind of a military term from back in Vietnam, where they found that people who got evacuated and treated within that first hour did better because they bled less, they had less shock, they had less organ dysfunction because of the lack of blood flow that occurs when you're bleeding.
Yeah.
We have knocked that way, way down in Houston. Houston EMS, the flight crew, and even the police forces have made it a big priority to clear the scene tactically and get medical personnel so they can get someone who's been shot or in a car accident. They can get them to treatment as quickly as possible.
Wow. So I want to get, I know, because from a previous conversation we've had, getting through your bio here, I mean, general surgeon, trauma surgeon, critical care, and you're also an entrepreneur who's invented, products and I guess equipment would be the best way to say it. One of which is on the helicopter to help warm up blood. Is that right?
Yeah, that one's not on the Herman helicopter, but it's on some other helicopters here in Texas. We, so it was interesting. I was a resident when 9/11 happened.
Okay.
And one of my mentors, a guy named Charles Cox, was in the Army Reserve when that happened and got deployed to Afghanistan in the very first wave of people to get sent over there into early 2002.
So was he at UT here in Houston?
He still is. He's a pediatric surgeon.
Oh,
here,
but he was in the reserves while here and then got sent.
Correct. Yeah, he got the call and said, "You're going to
go,
you better pack up because you're going to be on a plane to Bagram here pretty soon."
Wow.
And then came here to do residency training, largely because of Dr. Duke.
Okay.
Because he had been on he had this syndicated health segment that was on the evening news.
Okay.
When I was growing up. And most of the stuff wasn't surgical. It was about bee stings and allergies and things that, normal health problems. But at the end of that segment, it was always from the University of Texas Health Science Center in Houston. I'm Dr. Red Duke, with his mustache and his hat.
Yeah.
And I came here during my fourth year of medical school and did a rotation
Okay.
at MD Anderson, actually. But I did trauma call on a few nights over at Herman.
Okay.
And got to meet him and work with him a little bit. And just became a very huge fan of his.
Totally.
Yeah. And so came to do residency and train with him. And we ultimately became pretty good friends. I kind of came in at the tail end of Dr. Duke's career.
Okay.
And was probably the youngest person who was still willing to fight with him.
What do you mean?
Well, I mean, Red lived to argue and get mad and cut up, and I would poke him all the time. I'd be like, "Yeah, I guess that's how they used to do it back in 1875, Red. But it's a little bit more modern now." He'd be, he would call me. His nickname for me was Horsefly, because I was always buzzing around and wanting to bite him on the ass, and that was so. It just we had this wonderful relationship that because by the time I came up and became friends with him, he was very much this larger than life figure.
Yeah,
everyone would see him in the hospital. Oh my God, it's Dr. Duke, and I was very much not that way with him.
And he loved that.
He loved that, right?
Yeah.
He's a country boy from South Texas. Went to A&M, Yale leader of the Aggies.
Oh, I didn't know that.
Oh,
cool.
Yeah, just a very. I hate to put it this way because in no way was Red ever really normal, but in that respect, kind of a normal dude.
Normal dude, yeah.
And a great guy to be around, and he loved the whole TV and loved the attention. But I think towards the end, it started to be like, y'all can treat me like a normal person every once in a while too.
Yeah. And he lived at the hospital for a while, didn't he? Didn't they have an apartment up there?
So Red, the story goes that somebody, I don't know, disgruntled patient, disgruntled husband, somebody threatened to shoot Red.
No way.
For some reason. This was a long time ago.
My gosh.
And so Red decided that he wasn't going to stop seeing his patients because that was the most important thing in the world to him.
Okay.
We always used to say there's an easy way to do something, there's a wrong way to do something, and then there's the Red Duke way to do something.
Okay.
Right? And it was never going to be the easiest way to do it.
Okay.
But you could be sure that it was the safe way to do it.
Okay.
Oftentimes it took a lot of effort, but his focus on his patients was really something remarkable. And so he decided he was just going to move to the hospital.
Okay.
Started rounding at midnight to 2 in the morning because he knew that there wouldn't be anybody else around. And I guess he decided that this is just, he liked it.
Okay.
So he had an apartment that he kept.
Yeah.
But he lived at the hospital. And so when they renovated the hospital and they built, now 2 buildings ago, the Herman Pavilion,
Okay.
they built an apartment for him on the top floor, just below the Life Flight helicopter.
Oh, wow.
Yeah, pads and Life Flight operations. And he had this apartment there. And so he lived there, and his dog, Jake, didn't go anywhere without Jake. And
So Jake was at the hospital.
oh yeah, he had a hospital ID badge for
the
the
dog?
dog. And so he
Oh
would
my God, what a
he would
character.
walk the dog around the hospital.
Wow.
And yeah, that was
You got to have some pretty good clout to get the hospital administration to build you an apartment at the hospital. That's pretty solid.
yeah. Red inspired an awful lot of loyalty with the people who worked with him.
Okay.
And those people over time became the people who ran the hospital, more or less. Certainly on the medical side, the operational side. And so the executive administration side comes in, they're like, who's this guy? You know,
Okay.
everybody's like, yeah, that's Red. You can't,
Yeah.
you got to, we love Red.
Yeah.
You can't mess with Red. And that was true for like the longtime nursing staff, in particular. Red was shameless about bribing the nurses, right?
What do you mean?
Well, he would go to the kitchen, he would grab a whole bunch of strawberries and grapes and stuff, and then he would take them and distribute them to the nurses.
Okay.
Particularly the operating room nurses, and they just they loved him. They loved stuff. He'd do that every single day.
Wow.
Yeah.
Well, that's pretty darn cool. I wonder if there will ever be somebody else like him. And I mean, that's probably
No chance.
right.
No chance. The guy was an original. He was a truly unique product of Texas that anyone who were to try would be seen as trying and would fail in that regard. If somebody's a genuine cowboy that comes up through medical school 30, 40 years from now, maybe there'll be another one.
Right.
Maybe.
Yeah.
Maybe. But he's very much a product of the world he grew up
Yeah.
in. Country.
And he earned it. I mean, Lifelight being one of the fathers of that. I mean, that's a significant contribution to humanity. I mean,
There are so many people in Houston who are alive because of Red Duke.
Yeah.
Because of Lifelight, because of the attention that he gave to his patients and modeled that for an entire generation of surgeons.
wow.
Hundreds and hundreds. It's got to be in the thousands at this point of
Yeah.
physicians who he influenced, who have gone out and, he's been dead for 10 years now. I guarantee you, everyone who trained with him, you can still hear him when you're in the operating room and you're kind of trying to think of what you need to do. And it's not entirely straightforward. What would Red do here is a very, very good way to think about that. And then you think about it, you're like, oh, it's going to take me a long time. Yeah,
Yeah.
yeah, but it's the safe way to do it.
Yeah.
That's what he emulated every single minute of every day.
Wow. Okay, so you get to meet him, and that inspires you to get into trauma surgery.
Into trauma surgery. Yeah, it's kind of funny. The only time I think my mother's ever been really impressed with me and what I've done professionally, which I think is pretty cool,
Yeah,
right?
yeah.
Is is when I got to bring her to the hospital to meet Red.
Okay.
And she was like, finally,
Finally,
I
you.
believe that you've done something worthwhile.
That's awesome.
Yeah. I enjoy the rapid decision making that's required in order to do trauma surgery. But then also, I really like the physiology, the science of what happens when people are injured, thinking about how what you're doing now has downstream consequences 6 months or a year or 10 years down the road, even though you're in this moment and you have to
Wow.
act very, very quickly.
Yeah.
And it was, in fact, it was a discussion of that aspect of things where I first really connected with Red.
Yeah.
Was the whole idea of when you're making this decision in the first minutes of trauma, that patient is going to have to live with your decision for their whole life.
Yeah.
And the modern paradigm is people get injured, we take care of them as trauma surgeons, and then they go back to their primary care physician.
Mm-hmm.
That wasn't how Red did it.
Okay.
He kept them
Really?
forever.
Forever.
Yeah, and he didn't always have people coming back to see him, but yeah, he had this enormous practice of people that would come back and see him for regular, for their blood pressure medicine.
Wow.
Yeah, drove you crazy as a resident.
I bet.
You're like, okay, Dr. Duke, here's such and such, and he's here because his cholesterol is high and he doesn't believe his doctor and he needed to come see you. You're like, I'm here to be a surgeon, but this is Dr. Duke's clinic, and so we're going to do it the way he
Wow.
said. Because otherwise he's going to make you round at 2 a.m.